I think by any standards, AKI is an expensive condition. We estimate that the NHS in England spends somewhere between 400 and 600 million pounds a year on AKI, which is roughly £1 in every 200 that the NHS spends in total. But I think it's important to remember that it's expensive not just in financial terms, but also in human terms. We think that there are around 360,000 cases of AKI a year in England, and of those, about 20 to 30% are preventable. About a third of all cases of AKI recorded in hospital episode statistics result in death in hospital. And we think that there are up to 20 to 30,000 preventable deaths caused by AKI each year. It's hard to say if the costs are rising. I think what we can say is that if nothing changes, the costs will rise. We know that the risk factors for AKI are on the increase. We have an ageing population, and we have increased prevalence of many conditions such as diabetes and vascular disease that are risk factors for AKI. But we believe that 20 to 30% of cases of AKI are preventable. So we can say that if nothing changes, the cost of AKI, both financial and human, will continue to rise. But there is the potential to do something about AKI, to reduce the incidence and therefore to reduce the costs. In the study that we have done, we estimate that of the 400 to 600 million pounds that we think the NHS spends in England on AKI each year, approximately 2/3 is spent in the acute setting while a patient is in hospital having an acute episode of AKI, and around about 1/3 is accounted for by long-term need for renal replacement therapy as a result of AKI. We think that there are somewhere between 1,000 and 1,400 people each year who start renal replacement therapy on a long-term basis who would not be in that position were it not for acute kidney injury. And that's roughly a fifth to a quarter of all starters of long-term RRT in a year. I think it's most instructive to compare the cost of AKI with the cost of the four most common cancers. If we take our lower estimate of the cost of AKI, which is around about £400 million a year, then that is about 1.5 times what the NHS in England spends on lung cancer in a year, and it is more than the cost of bowel cancer. If we take our upper estimate of £600 million a year, then that is more also than the cost of breast cancer and more than the cost of prostate cancer. I think that's an instructive comparison because these four most common cancers are very much in the public consciousness, and AKI is under-recognised. Studies suggest that somewhere between 20% and 30% of cases of AKI are preventable. If we take the lower end of that range and we estimate that 20% of cases were in fact prevented, we think that the savings to the NHS would be somewhere between 90 million and 120 million pounds a year. That money would be enough to purchase for the NHS, to pay for either 2,500 to 3,500 extra nurses or 450 to 650 extra consultants.